Hi, I'm Dr Stuart.
And I'm Leah Tyndale, and this is What's Up, Doc?
Absolutely, this is part 4 in our series on mental health. And today we're going to be talking about hope and recovery.
Because there is hope, isn't there? And there is a recovery path.
I hope so.
Hope. I see what you did there. But it just might take a little bit longer than maybe we expect.
It takes a while. And that's part of the challenge, is to set realistic expectations from the outset. So once we've got our diagnosis and once we've agreed a treatment plan, first and foremost, not every treatment works first time every time. We may have to explore different solutions to this problem. It may be a combination of some of those treatments we've talked about before, and it may be that some things work better in certain contexts and not in others. So once we've got ourselves onto that pathway, it's then about looking forward and saying, okay, where were we? Where are we heading?
Yeah.
And setting goals to get ourselves out of that dark place that we've often found ourselves in.
Yeah, absolutely. And I suppose as well, it depends on the type of mental health condition that you're dealing with. Then depends on how long treatment is, how long the diagnosis process is. Like, so for things like ADHD, especially in Western Australia at the moment, the diagnosis wait to get in to see, the psychiatrist and everything is so
many
blown
months.
out.
Yeah, it can be several months, and some people are waiting up to a year at the moment. And in paediatrics, it's even worse.
Yeah.
So yes, there's that delay in getting the diagnosis and then getting onto treatment. And for many patients, it's a light switch going off, and they suddenly feel so much better, and life starts to get back to normal very quickly. For others, it's a more gradual recovery, and it's an acceptance and a learning curve, and we need to progress through that more slowly. So there's no one size fits all, sadly. It's a journey that we take together, and again, that's a journey that I take with my patients on a daily basis, to see where we've gotten to and what adjustments do we need to make. There's fine-tuning often along the way in order to continue that improvement.
Absolutely. And I think that's a really great way to frame and wrap out our mini-series as well, is looking through at this whole process of mental health and getting healthier and recovery and all those sorts of things. It's a process, it's a journey, and there's no time frame, and you shouldn't ever put pressure on yourself to be like, I should feel better, why isn't this working? Because none of that helps in the long run.
It ultimately doesn't, and you're right, but it's also human nature, and every patient wants the recovery to happen quicker than it does.
Magic pill. Regardless
of how quickly it happens, they still want it to be quicker. And of course I understand that. If you're in a place of suffering and you've started to feel better, you want to feel better and better and better, and that makes perfect sense. It's human nature. But ultimately, that is part of the discussion that I have to have. It's a very difficult conversation sometimes, is to say, we've been through some stuff here. We've been through a very challenging time. It's been distressing. And actually, post-recovery or mid-recovery, there may be other issues to deal with.
Yes.
So a good example of this is the adult who has recently been diagnosed with ADHD. It may be a very successful adult. It may be somebody who's done quite well in their career. But once they get the diagnosis, they get the treatment, they suddenly realise what life could have been like. And there's almost a rebound grief while they reflect on, if only I could have realised this 10, 20, 30 years ago, how much better would my life have been? How much easier could my journey have been? And that rebound grief can then potentially need psychology input.
Yes.
Or other things in order to help treat it. So there can be other issues manifest out of that original diagnosis and the subsequent suffering that occurred before the diagnosis was made.
I think that's the other thing as well, isn't it? We're talking about, like, often the human brain, which is so complex, and you've got, your external factors, you've got your internal factors, like then you've got, chemical imbalances versus trauma or all of that kind of history, all blending into this unique situation.
Absolutely.
And then depending how successful your treatment up to this point has been, so say maybe you're up to your 6th GP, or maybe you're feeling really fatigued with the whole process, then that can drag things on, and so
people give up. And that does happen. They just become accepting of something that they shouldn't have to accept. And sometimes it is as simple as they didn't have the energy to actually invest the time to go and say, well, actually, I'm just bobbling from GP to GP to GP. But as we've talked about in a previous podcast, is it actually that you're not picking a GP who has a special interest in mental health, and therefore you're getting a similar picture every time, and Yeah, the GPs are all capable of dealing with these things, but some are more passionate than others and therefore may have a wider range of current knowledge than others. And therefore, maybe you need to address that more directly by finding a GP who's interested in this area. But yeah, it's exhausting. This is a genuinely difficult problem for patients to solve, because when you're so exhausted, you have a sick brain that's not necessarily thinking clearly. It can really confound the ability to seek the appropriate treatment and get the appropriate help.
So for those people that are experiencing that fatigue and just so over going on this journey of, and they can't even put one foot in front of the other, what is something that that you advise people to do? Is it as simple as, getting a family member and being like, can you drive me to the GP because I'm over trying?
If that's an option to them, then absolutely. Leaning on our friends and family is important in these situations, because it helps to get some additional perspective as well. And it's not uncommon actually for somebody to come in with a family member to give me additional perspectives on what's going on. So that can sometimes be helpful if it's a trusted friend or family member. But there are other sources of support for people in those situations as well. I guess, if we really feel like we're getting to the end of a rope, I often tell people, tie a knot and hold on. Emergency department. If you really feel like you've gotten to the end of that, that rope, then that's a good place. There's always going to be psychiatric support there, and they can get somebody to sit and talk with you and risk assess you, more importantly. And then if we need to, they can either signpost you back to the GP, they can get you admitted, we can do what needs to happen. There's urgent care centres, there's GP out of hours, there's your own GP clinic, are also good sources of support and advice if you need them. There are online resources, phone-based services like Lifeline, or places like Beyond Blue, which is a website, and another good website is the Black Dog Institute. So there are a number of resources and support, and this is by no means an exhaustive list. There are a lot of support services out there as well. There are other places we can turn, and a lot of these places will be able to offer you some peer support, and potentially through that you can have a discussion and say, I really just don't feel I've been getting the right treatments, and maybe they can recommend a different GP or a different service that you can engage with that might be more helpful or specific to you. So there is always an alternative, there's always somewhere else to go, and as I say, if you feel like you're getting to the end of your rope, that's when you need to reach out for help. And if it's to someone nearby, then great. But if you're really not sure where to go, come see a GP, go to the emergency department. These are good spaces to go to in order to get that urgent support that you need.
I suppose the biggest message, isn't it, just don't give up.
Absolutely.
Keep on looking. There will be the right fit, whether that's to be GP or, starting even with a friend and talking there. And then maybe someone else has a great GP that they know that is more specialises in that mental health space. That's a great way to go about it as well. But don't feel like you've been forgotten or that, you're overlooked just because you might have fallen through a few cracks.
Absolutely.
You're still very, very, very valuable, and your mental health is worth valuing, looking after, and seeking help and finding out.
And if previous doctors haven't gotten to the bottom of this, then maybe we just need a fresh set of eyes on it. Sometimes that fresh set of eyes, that new perspective with the additional information that you can bring from what we've tried before that hasn't worked, actually is quite a straightforward conversation for me to have with a patient when they come in and they say, I've tried everything. And I'll say, well, let's break it down. Let's see what we haven't tried, because clearly we haven't tried something. There are so many things that I can do that we can start breaking it down and say, well, we haven't tried this. Why don't we give this a try? Here's what I would expect to happen. So we don't just go back to the start of the list and try things again. That's utterly pointless. We want to explore what we've done, and that allows me to then look at my list of things we haven't done and start working through those.
Absolutely. It's so important. It's so important to not give up, and I really hope that this mini-series has been helpful for everyone listening and watching as well, that hopefully it's given you a bit more insight. And is there anything that you'd like to just, I suppose, finish on, Dr. Stuart, with your wealth of knowledge that you'd like to leave everyone with as we wrap up?
I think just that there are GPs out there who have a passion for mental health. They are passionate about helping and supporting people. And if you feel like you've not made a good connection for whatever reason, it's not a slight on your own GP, it's just that you haven't made a good connection, maybe their expertise lies in another space, then don't give up hope. Don't just walk away from it and go, well, I've tried that, it didn't work, I'm just going to have to live with this. Explore it with someone else. Give someone else a chance allow them to bring their expertise to bear, and let's just see whether or not we can actually make that difference that you need.
Amazing. Well, thank you so much, Dr. Stuart. Really appreciate always your insights.
Always a pleasure, Leah.